Tuberculosis. The name itself sounds ancient, echoing from a time long past, and it is. This disease has plagued humanity for millennia. Scientists have found evidence of TB in Egyptian mummies, their bones bearing the marks of this relentless killer. Tuberculosis is caused by a bacterium. This bacterium is tiny but powerful. It infects the lungs, but it can also attack other parts of the body. The spine, the brain, even the kidneys can fall victim to this disease. For centuries, TB was a death sentence. People called it consumption. It slowly consumed its victims, leaving them weak and wasting away. There was no cure, no effective treatment. Today we have made progress in the fight against TB. But it is still with us. It remains a major public health challenge around the world, especially in developing countries. Tuberculosis spreads through the air. When a person with active TB coughs, sneezes, or even talks, they release tiny droplets into the air. These droplets contain the TB bacteria. If you breathe in these droplets, you can become infected, but not everyone who is infected with TB bacteria becomes sick. Some people have latent TB infection. They have the bacteria in their body, but it is inactive. They don't feel sick and they can't spread the disease. However, latent TB infection can become active TB disease. This can happen if a person's immune system is weakened. HIV infection, malnutrition, and diabetes can all increase the risk of developing active TB. Tuberculosis is a global problem. It is one of the top 10 causes of death worldwide. Every year, millions of people become sick with TB and hundreds of thousands die from this preventable and curable disease. TB is most common in developing countries. Poverty, overcrowding, and limited access to healthcare all contribute to the spread of TB. The regions with the highest TB burdens are in Africa, Asia, and the Western Pacific. Tuberculosis is a sneaky disease. It can grow slowly in the body, and symptoms may not appear for months or even years. This is why it's so important to know the signs of TB. The most common symptoms of TB are a persistent cough, chest pain, and coughing up blood. Other symptoms include fatigue, weight loss, night sweats, chills, and loss of appetite. If you experience any of these symptoms, it's important to see a doctor right away. A simple skin test or blood test can determine if you've been infected with TB bacteria. A chest X-ray can show if the bacteria have damaged your lungs. Section 5. TB and the famous. Tuberculosis has touched the lives of many famous people throughout history. The ancient Greek playwright Euripides, the Roman Emperor Hadrian, and the English poets John Keats and Percy Bysshe Shelley all died from TB. In the 20th century, TB claimed the lives of the writer George Orwell, the actress Vivien Leigh, and the singer-songwriter Cat Stevens. These are just a few examples of the countless people who have been affected by this disease. TB does not discriminate. It can affect anyone regardless of their age, race, or social status. Section 6. Treatment and drug resistance. The good news is that tuberculosis is curable. With early diagnosis and proper treatment, most people with TB can make a full recovery. The standard treatment for TB is a combination of antibiotics. These antibiotics must be taken for several months to completely kill the bacteria. However, drug-resistant TB is a growing problem. This occurs when the TB bacteria mutate and become resistant to the antibiotics used to treat them. Drug-resistant TB is more difficult and expensive to treat, and it is a serious threat to global TB control efforts. Section 7. The fight continues. Research and development. Scientists around the world are working tirelessly to develop new tools to fight TB. This includes research into new drugs, vaccines, and diagnostic tests. New drugs are needed to treat drug-resistant TB. Vaccines could help to prevent TB infection in the first place, and better diagnostic tests could help to identify people with TB earlier when the disease is easier to treat. Section 8. Public awareness, our greatest weapon. Public awareness is crucial in the fight against TB. The more people know about TB, the more likely they are to seek early diagnosis and treatment. This can help to prevent the spread of the disease. We need to educate people about the symptoms of TB, how it is spread, and the importance of getting tested. We also need to address the stigma associated with TB, which can prevent people from seeking care. Section 9, a future free from TB. Tuberculosis is an ancient disease, but it doesn't have to be a part of our future. With continued research, improved healthcare access, and increased public awareness, we can eliminate TB as a public health threat. It's a future worth striving for, a future where everyone can breathe freely without the fear of this ancient killer.